Welcome to the Dr. Lori Marbus podcast. I'm so excited to welcome Dr. Stephen Lome. How are you, sir?
Doing great. Thank you very much for having me.
Oh, I'm just tickled pink to hear your story because you have quite the personal transformation. But tell us a little bit first about yourself, as I always love to have physicians on and kind of get an idea of why you wanted to become a doctor to begin with, and then just kind of your own health struggles and, just your story of your journey to plant-based and your eventual recovery and an amazing life.
It's actually a little bit of a long story, so I'll try to keep it a little bit short, but I grew up standard American family, standard American diet, and just, consuming what our culture told us we should eat, what tasted good, what was convenient, and so did my whole family. And so really a typical background in the Chicago suburbs, and loving family, caring family, but both my parents ended up getting close to 300 pounds and my sister 450 pounds in high school. And, initially, I personally was a little bit more resistant to the weight gain. I was a little bit lucky, but it caught up to me eventually. I became a physician and now a cardiologist in the Rush system in the Chicagoland suburbs. And throughout my training, the stress and everything, and, it was a lot of stress eating and things involved. I ended up gaining up to 265 pounds, so about 100 pounds heavier than what I am now. And so really my background comes from the same place that a lot of Americans' backgrounds do. They have busy lives and they just kind of flow with their culture, and before they know it, a couple pounds a year, and they whoa, what happened? Now I'm up to 265 pounds. And so, it kind of all came together. It was interesting that I went into medicine really for good reasons. I enjoyed science behind medicine, and I enjoyed interacting with people. It made a lot of sense to have that relationship, the patient-doctor relationship. I just love that relationship. So I really enjoyed being a physician, and cardiology specifically for a couple of reasons. I knew I wasn't going to be a surgeon sitting in an operating room. That just wasn't my thing, and the cardiology world allowed me to do a little bit of the imaging, and it was very intellectually stimulating. And I knew that cardiovascular disease is the #1 cause of death in the United States. And so if there's an area that I could make an impact, well, it makes sense to go right there, because if it's the #1 cause of death, maybe there's more that we can do to help more people and prevent disease or make a difference. So that's the background as to where I came from culturally, personally, and coming to the world of becoming a cardiologist. But the whole story kind of shifted around a bit 4 years ago. In 2014, when I was about 100 pounds heavier, I was starting to get a little frustrated in my clinical practice, just because, I was doing a lot of guideline evidence-based medicine, prescribing medications for hypertension, a little bit of diabetes stuff, not too much, high cholesterol, and, running a lot of diagnostic tests, sending people for coronary stents and bypass surgeries. And it was a little frustrating because, patients for the most part didn't really like medications. They'd have side effects, they cost money, and even when somebody would take the medications as prescribed, and we would think that it looks like the risk factors are relatively well controlled, they could still have a heart attack, a stroke, need a bypass surgery, or a coronary stent. And it wasn't really quite connecting all the dots together at that time, but now I realize it's because I personally never spoke to my patients about their diet and their lifestyle. Because personally, I wasn't following a healthy diet and lifestyle myself, and I wasn't trained in nutrition or lifestyle medicine. I had never heard the term lifestyle medicine. I had never heard the term plant-based diet before, and all of my training and all of my personal life just never came across it, which was kind of crazy now that I think about it, because it's certainly a growing movement, and I think most people are familiar with it nowadays, I would hope. But so 4 years ago, that's where I was, 100 pounds heavier, a practicing cardiologist in a busy practice, mostly prescribing medications, ordering tests, just going with the flow, and getting tired. And as I personally started suffering from a lot of obesity-related ailments, acid reflux, I know I had sleep apnea, my blood pressure was going up, my back went out on me multiple times, and I would see a lot of patients, and I'd hit the afternoon and be like, I'm so tired. When is my clinic going to be done? I don't know if I can make it through another 6 patients. I knew personally I needed to make change for myself, for my own health. as I was seeing my patients suffering from all these chronic diseases, and I thought, wow, I'm in my mid-30s, I'm already developing all these issues, just not feeling well. I'm a cardiologist here. Shouldn't I really be trying to follow a healthy diet and lifestyle? Because everybody knows in the back of their mind they should be eating healthy and taking control of your own health. At the same time, you're taught, based on your culture, not to worry about it. Just go out and eat whatever you want. Our culture isn't all that big into exercise and physical activity. And so, and I wasn't trained as a medical student and as a resident in cardiology training, I wasn't trained to talk to patients about diet and lifestyle. So it really wasn't my mindset, even though everybody knows just, in the back of their mind, they should be eating healthy and staying active and focusing on being thin. It's just so much a part of our culture to not be that way. So when I was suffering from all those things, I had the realization I need to make a change myself. So I made all the mistakes that the typical American would make when they're trying to lose weight. First of all, thinking exercise is the key. So I say, I see all these runners out there, and when they're running, they're all thin, right? So maybe if I start running, I'll be thin too, and I can lose a lot of weight. When you do the math, though, it takes about 3,500 calories for 1 pound, and that's almost 30 some miles of running to lose 1 pound. That takes a lot of running. And that's why they always say you can never out-exercise an unhealthy diet. 80% of losing weight is what you eat, 20% is exercise. But I went straight out saying I'm going to sign up for a triathlon and a marathon, and I'm going to exercise like crazy. And so I did that, and I made some minor, diet changes, trying to avoid junk food, processed food, not eat as much dessert as usual. And I ran 2 marathons, initially obese.
Oh, wow. Wow.
I walked a lot of it. I had a lot of injuries, struggled throughout the way, but I got through it. And as I was doing that, over about a 2-year time period, I lost about 40 pounds and trying to read about nutrition while I was at that. And of course, where was the first place I went when I was reading about nutrition was the Dietary Guidelines for America. So I read the Dietary Guidelines for America, that huge document, 3 times over. It's a big document, thinking this has got to be the truth. This has got to be what we should know, right? The government's not going to lie to us. So let me read these dietary guidelines. So I read them, and it's nice because as I'm learning about this, I do start engaging my patients more in discussions about diet and lifestyle, because finally I'm doing it myself. But I was kind of still a little bit misguided because I was telling them what I was reading. Chicken and fish, chicken no skin on it, nothing fried, olive oil's fine, 3 servings of low-fat dairy a day is what I was reading and what I was telling them. And then half of your carbohydrates can be refined carbohydrates is what they say. And the unhealthy foods in moderation, So I did all that, and I thought doing a good job following those dietary guidelines. Pizza only once a month, dessert only once every week or 2, and really getting rid of the sugary drinks as much as possible. But they were still there in moderation. 2 years, 2 marathons. I was like, wow, 40 pounds is great, but man, that was hard. I know what my patients are going through. It's not easy to lose weight. And I thought I was doing good diet-wise and exercising like a madman. And then I thought, okay, fine. Well, if this is just the way that it is, I guess I have to wait till my 3rd, 4th, 5th marathon, because my goal was to get to my ideal body weight. 6 foot tall, I should be 170 pounds. And I said, that's what I got to be at. And I still have 60 pounds to go. But then, it was random. Like Netflix said, hey, check out this thing called Forks Over Knives. And man, I'll just never forget. I'll never forget my thoughts, what was going through my mind as I'm watching this documentary, because I never heard of the concept of a plant-based diet. And I thought that there wasn't all that much that we could do for cardiovascular disease prevention besides the pharmacotherapy directed at hypertension and high cholesterol and take your aspirin and all those things. And then you see Dr. Esselstyn stand up there and say, heart disease need not exist. It's a toothless paper tiger. And if it does exist, it need never progress. And I'm just like, what are you talking about? This is bogus. There's no way this is real. It's propaganda. Where is this guy coming from? Because I wasn't taught this in medical training. And if it was true that you could halt and reverse a vast majority of cardiovascular disease with plant-based diets, then shouldn't that have been one of the main focuses of my medical training? I mean, you would think And so this was my mindset, thinking, okay, I'm following dietary guidelines of America. I'm exercising. I'm struggling losing weight. And then this guy comes out and tells me that everything I've been doing is completely wrong. And everything that I was taught in medical training had nothing to do with treating the cause of the illness. And we could annihilate heart disease if we could just change dietary patterns in America. I was like, this is not real. There's no way. And so then, like a good physician trained to practice evidence-based medicine, guideline-driven, look through the peer-reviewed journals and all the publications, I said, let me dig into this. I want to see if what this guy's talking about is real. And the more I read about it, I'm like, this is real stuff. Look at Dean Ornish's publications. I never heard of the name Dean Ornish, and reviewed it, and his data is amazing. And Dr. Esselstyn's, while it's not a randomized controlled, interventional trial, it's still, nutrition trials are challenging and difficult to do. And his data was strong enough to convince me. And then what really kind of sealed it all together was Ken Williams, what a humble guy, what a great guy he is. He knows his stuff so well. And of course, he was the past president of the American College of Cardiology and the chief of cardiology at Rush, where the system that I'm currently a cardiologist in. And he makes those statements like there's two types of cardiologists, plant-based cardiologists and those who have not read the research. And the one that really got me the most, though, was he says that a whole food plant-based diet's a cure for heart disease. And if you're a cardiologist and you don't tell your patient about the cure for their disease, that should be considered medical malpractice, because you can't withhold a cure from your patient. And so when I hear those things coming from these very well-known people, that just kind of sealed the deal. This is real stuff. And I kind of completely knew what was missing, not only from my personal approach to losing weight, but my professional approach as to how I took care of patients. And it's frustrating. I was almost angry when I watched that documentary. I was like, how can this be real? How could I not have known this stuff? I mean, I would ask all the professors, I understand the pathophysiology of heart disease, and you get the endothelial cell injury and inflammation, LDL gets oxidized, and foam cells and smooth muscle cell migration, all these things that we read about how plaques form. But I'd ask, why does this happen? What's really going on? What's the connecting factor between it all? And they'd say, it's a part of aging. It's genetic. If you smoke cigarettes, you damage the lining of the endothelium. And if, diabetics, it's all these different things. I was like, but still, there's something that's missing. And this was it. Because if Dean Ornish can show that at 5 years, 99% of patients angiographically halted or reversed their disease, then that's it. The cause of heart disease is diet and lifestyle related. That's it. So shouldn't the treatment be improving diet and lifestyle, not drugs and stents and bypasses? And so that was my whole revelation, putting together my personal life and my struggles losing weight with my professional somewhat dissatisfaction the way I was practicing medicine. So I transitioned to a plant-based diet within about 48 hours or so, and ran my third marathon. And within 6 months, 60 pounds came off, and I was at my ideal body weight. And I was like, wow, I wish somebody would have told me all this before. It would have saved me a lot of trouble, But
wow,
that's kind of where my background comes from.
Yes. So that revelation with the patients, and you're just like, what have I been doing?
I feel because they look to their doctors for advice for everything. And I'd have people come after heart attacks or bypasses and say, Doc, what should I be eating? And I'd say, I don't know, just, only eat fast food once a week, and just try to avoid junk food a little bit here and there. I give them vague things and kind of change the topic, because I really just didn't know much nutrition, because it just wasn't anything that I was trained in. And I think a lot of physicians are in that same boat. So.
And then, I did this in early 2012, and it was a patient who we kind of accidentally moved to a plant-based diet because she said meat and dairy upset her stomach. Those were her exact words. And I said, well, stop eating meat and dairy. But when she came back, what was incredible was her daughter went on the diet with her and pulled herself off 2 ADD meds. And she's like, Dr. Marbus, why was she able to do that? I was like, I don't know, but that's really cool. What were you eating? And it was plants. I said, so you were eating plants? She goes, well, yeah, you told me not to eat meat or dairy. That's what's left. I'm like, oh, like I'm so thick-skulled. I'm like, what is wrong with me? And what was incredible was this revelation. But then I was like, well, then I read T. Colin Campbell's The China Study, like in literally 2 days. You can turn cancer off and on. What? And I mean, and then you feel this guilt, right? You're like, holy moly, look at all those people I could have been helping.
Yeah.
But instead, and I've always been active. I didn't have a weight issue, but I had horrible allergies. My thyroid, I've been hypothyroid for 22 years since the birth of my second child. And Jonathan was born with hypothyroidism. Like, he had a positive metabolic panel. And you just having a new baby, they do the panels, and then 2 weeks later they repeat. And his second one was negative. He ended up having pretty significant, learning disorder, with dyslexia. But I was diagnosed with hypothyroidism right after, like, maybe he was 2 months old. And but my dosage continued to escalate until I went plant-based, and then it started decreasing. And that's 15 years in to being. Now I'm still on a much lower dose, but I've quit burning out my thyroid. And so that, it was such an amazing response. But then I was like, for me, it was hard. It was like, how do I approach this with my patients? Like, how do I do? Because there was no plant nutrition project. There was no place for me to go and learn. And so that's what we're hoping also with the journal, who Dr. Kim Williams is our editor-in-chief. Yes. And we're going to be creating, CME and helping physicians transition this to their patients, because that is the social contagion you need, right? This is my theory.
That is absolutely key.
Yeah, so you have the patients and the physician relationship, and that spreads like wildfire, right? And
right.
Yes, that's so incredible.
More and more people have a similar realization like I did. I sure hope, because like you said, I kind of look back and think, what was I doing this whole time with my patients? It was just completely off. And the other perspective that really, really changed in my whole crazy journey is now when I see a patient who is 250, 300 pounds, diabetic, who had 2 bypass surgeries, are only 50 years old, they have an amputation of their leg, and they're debilitated, I really just think to myself, whoa, that didn't have to happen. That was all preventable. And our culture has failed this person, our food system has failed this person, and our healthcare system really has failed this person because it was all preventable. And it just, when you see it from the other side, once you've been able to make the change and maintain a whole food plant-based lifestyle yourself, and then you see these people suffering from these chronic diseases, and you say, wow, we really need to wake up, because it's just the wrong paradigm that we have in medicine for these chronic diseases. We really need to get off of this acute care model and get more of an integrative approach to help treat the cause of the illness. And so, seeing it the other way is really, it's almost hard for me now, because you feel so sad and helpless that, once people have already gotten to that point, it's so much more of a challenge to get them through that and reverse those diseases. But got to keep working at it.
Absolutely. So tell us what you're doing now, because you have a lot of cool initiatives and what you're doing with websites and stuff.
Yeah, so I'm doing a lot of different things. So basically, when I had this revelation, I was working about 70, 80 miles outside of Chicago. And so I said, well, there's not as much I could do in the whole plant-based nutrition realm out here. So I knew of Kim Williams and met him and spoke with him. What a great guy. He totally convinced me to join the Rush system. So I moved closer to Chicago with the whole mindset of, now that I'm closer to Chicagoland, I'm going to be able to integrate more plant-based nutrition into my clinical practice and hopefully make a bigger difference. So I joined the Rush system at the hospital Rush-Copley in Aurora, the second biggest city in the state of Illinois. And I've only been there for about 9 months or so. So some of the initiatives are still going, trying to get foreigners lifestyle medicine going there. We're doing some lecture series and community events, and really I got another one of the cardiologists at the group to go plant-based already. Awesome. And another one is super close. So within the Rush system, I think we're going to be up to 9 plant-based cardiologists soon. Isn't that great?
That's awesome.
So I started that, but pretty quickly found out that it's a challenge to really integrate plant-based nutrition into a big healthcare system. And I'm still learning more how to do so. And I'm sure that there's other approaches that I need to learn and take in order to get it done. But the whole financials behind some of these things, it's unfortunately the way our system works, there's not a lot of money in prevention of disease. The way our business model is set up for healthcare. So trying to say, hey, listen, let's get people all to change to plant-based diets to reverse their diabetes, and they'll have less heart attacks and need less bypass surgeries and less stents. The hospitals go well. I know that makes sense, but that's just not a good business model. And so as we tried to model some things out, it didn't quite work as some of the programs, but I'm still confident we're going to get some good things going there. But in the meanwhile, I said, what else can I possibly do to make a difference in this whole plant-based nutrition realm? And I know personally, I'm not a big researcher. I'm not going to publish some breakthrough articles, and I don't really think we need to, honestly. I think the evidence is there already with Ornish and all the other data that we have. I think we have plenty of evidence to say that a whole food plant-based diet is the ideal way to eat, especially once you have cardiovascular disease or other chronic illnesses. So, should I delve into the whole research? Probably not. I'm a website guy. As a medical student, I made a website called learntheheart.com, which was up to 25,000 unique visitors daily.
Oh, wow.
Yeah. And so it was great. It was a free website. So I really got into that. And I said, let me just try to do the same thing with this whole intensive cardiac rehab, which includes plant-based nutrition, because that's what they call Ornish lifestyle medicine. They call it intensive cardiac rehab, not just regular cardiac rehab that people go to exercise. It's intensive because it includes the whole food plant-based nutrition as a main component of it, but yoga, stress reduction, community support, and the regular exercise too. And I said, well, why don't we give a free do-it-yourself online program to really go through things for patients so they can just go somewhere and step-by-step go through videos on how important lifestyle medicine is and how important the diet and nutrition and all this stuff relates to it. So that's heartstrong.com. It's been up for about a year now, and it's still definitely a work in progress. I have a lot of more things I'd like to do with it. But it basically, first section is what is cardiovascular disease? Because I tell people knowledge is power. If you don't understand your disease, how are you going to overcome it? You need to, Dr. Esselstyn totally emphasizes so much the endothelial cell injury. You got to understand that, and understand that if you get your eyeballs down into your arteries and you see all that inflammation going on in that plaque, you imagine it being on fire. And if you eat something unhealthy, you're pouring gas on that fire. You're fueling the flame when you're eating your eggs, bacon, and sausage, or your refined carbohydrates, or all those oils. You're pouring gas on that fire. Why would you ever do that? But if you eat oatmeal or drink water as your beverage, or eat some good unprocessed plant-based, whole food plant-based meals, you're pouring water on that fire, and you're putting out the flame. You never want to pour a drop of gas on that fire, none. So that's the whole first section, is just educating people on the whole process of cardiovascular disease and hypertension and diabetes, and emphasizing how plant-based diets are important there. But then section number 2 really delves into the nutrition part, because they're always going to ask, where do you get your protein, and what about these vitamins and all these things? But is there real questions people have? So all those things need to be answered. And I go through the Mediterranean diet and the DASH diet and say, you know what, they're better than the standard American diet, no question about it. But they're not ideal, and it's not the right thing to do. You should really be on a whole food plant-based diet and can progress them to that conclusion. The third section goes through the whole exercise component. There's a weight loss component, and then a wellness component to Heartstrong.com. And then the last part kind of puts it together in a phase 1, phase 2, phase 3, because some people really like that structure to try to slowly progress people through it. So again, it's still a work in progress because I have a lot of other things going on. I'm only one person. I'm hoping that eventually it'll be really, really clean and perfect and finished and set up, but slowly getting there.
What do you mean? You're just a busy cardiologist, 6 kids, and a wife that's a doctor, and what are you talking about?
Yeah, plenty of spare time.
Oh my goodness.
But the other thing that I'm doing, which I'm so excited about, this is just a little bit less than a month old. So what happened is through Rush-Copley, we had these community events where I would go and I would give a lecture for an hour on the power of plant-based nutrition to reverse cardiovascular disease, and mention a little bit of diabetes and hypertension and such. And then we would feed the whole community. We had, I think, 60 or 70 people show up last time. We feed them a whole food plant-based dinner. It was a great lentil stew, salads. It was wonderful. Everybody loved the food so much. So we feed them a whole food plant-based dinner. I give them this talk, and then have patient advocates come up and tell their stories, how much they love plant-based diets and how it's helped them reverse their disease and everything. And then have some plant-based advocates kind of hidden in the audience, so that when it's done, they mingle and they talk to people. Oh yeah, I've been on a plant-based diet. It was a really great event. Well, what happened this last time was I advertised out there to all the plant-based community through Plant-Based Nations pods and stuff like that. Hey, I'm doing this little event if anybody's interested in showing up. And there was a huge amount of plant-based nutrition advocates that came to this event. And they were all super interested in being activists to really promote plant-based nutrition, help other people transition over and do the right things. And so they kept me there until almost, it was 10 o'clock at nighttime talking. I was so surprised at how many people were so passionate about what I was speaking about and wanting to make a change. They said, listen, Dr. Lome, we really need to get together and create an organization that can really push this forward and help the community. And I think it was the absolute right thing to do. The more and more I think about it, the biggest struggle that we have in our whole healthcare system or as a physician is overcoming the cultural barriers to getting on a plant-based diet and giving people the resources, because we really have lost the skill as a culture on how to cook good, clean, healthy, unprocessed plant-based foods. Whole food plant-based meals is not a part of our culture anymore. Nobody knows that skill. We need to bring that skill back and give a community that can support people who want to go through that transition over to a whole food plant-based diet. Because I tell you, you may have had this before too, before you were working straight into this, but I could talk to a patient for 60 minutes how great a plant-based diet is, how it can reverse their heart disease or diabetes or hypertension, how wonderful the food is. There's 100,000 different edible plant-based species out there, and you can season them and you feel full, and it's great, and it's cheaper to eat this way, and it's better for the environment, it's better for the animals, it's better for everyone, whatever. I don't really get into I get into stay with the health part, but you can talk their ear off like crazy about how great a whole food plant-based diet is. And they might buy in a little bit, but then they leave that room and they don't have any support. Their family might not support them. The community doesn't support them. There's no restaurants out there with plant-based menu options, at least not whole food plant-based menu options for the most part that are free of oil. And it's a struggle. And I could, maybe I'll get them to watch a documentary if I'm lucky. I've even handed patients books when I really think they're interested. I keep a stack of books in the back and kind of tailor which book I give to which person, depending on what I think that they would it would benefit them the most. And I find that a lot of times people, I give them the book, they want to read it. They might not watch the whole documentary that I recommend to them. And a lot of it is just their mindset, the culture. And so what I really needed to develop, what I felt like we really needed, is a really big community support system for people. So what we did is founded a nonprofit organization called the Chicagoland Plant-Based Nutrition Movement, 501c3 profit. And we have more than 100 members, actually a couple hundred members already, and it's less than a month old. And dozens of them are actively like, where's our volunteer opportunities? Let's get going. We want to volunteer. They're so excited and they want to get going already. Like, whoa, we need to get things organized and figure out our approach here first. We have a lot of great initiatives because the way I see it is we need to have all the tools out there and make it easy for people to transition to plant-based diets. So once we get that set up with, we want a mentorship program where somebody says, okay, I'm interested, I want to do a plant-based diet, help me out. We hook them up with a mentor who can have lunch with them, go shopping with them, call them on the phone, give them recipes, cook together, do whatever. So we have that. We want to have cooking classes that are free or very reduced cost and how to, whole food plant-based 101. There's so many different things you could do, how to cook whole food plant-based in an Instant Pot, how to cook Indian cuisine or Mexican cuisine or whatever cuisine, whole food plant-based. And we want to have little community events so that once they go to the physician's office, the doctor says, go on a plant-based diet. They say, how do I do that? The doctor says, hey, here's a mentor you can hook up with. And then right there's a cooking class. And then once you get into it, you get your recipes, just show up to this community event, this potluck, which is whole food plant-based, taste all these different foods, meet these people, have the community support. And then that's what's going to really allow them to be successful transitioning. And so what I found in Chicago is there were many different little pods or groups that were getting together about whole food plant-based nutrition. They had 20 members or 50 members, and even one of them in the northern suburbs had 500 members in a whole food plant-based no oil cooking club. But all of these little areas were disconnected. They never communicated with each other. They didn't work together, and they didn't really outwardly seek to grow in regards to patients who need help or get into physicians' offices or such. So I said, let's connect all these dots in all of Chicago. Let's all work together. There's so many great, passionate people here. Let's put it all together and create this whole network of people who can mentor people, do cooking classes, help each other out. And eventually, once we get this, this whole act together here, and get into physician offices, because I think that's where we need to get people. We need to get the physicians to buy into this. And we want to actually bring in whole food plant-based lunches to physician offices, because they're so used to pharmaceutical reps coming in and buying a pizza or buying unhealthy stuff and saying, hey, prescribe this drug for hypertension, or prescribe this drug for, you know, this blood thinner or whatever it is. Well, wouldn't the staff hopefully really enjoy a wonderful gourmet whole food plant-based lunch instead of something else? I hope they would, for a change. And then if a physician comes in and says, hey, listen, I'm not selling you anything here. I'm not trying to push a drug or a device on you. I'm just trying to tell you that we have these resources available for your patients, and this is the evidence, the power behind a whole food plant-based diet. Look at this. Here are the publications. Here are the resources for physicians, and this is wonderful. So this is the way to go. So when you have patients, please consider sending them to our mentorship program or our cooking classes or whatever, and we'll take over. Because, as you know, most physicians' mindset is nutrition's not my thing. If somebody wants to learn about nutrition, I'll send them to a nutritionist or a dietitian, which most of them aren't plant-based. They're based on, you know, USDA Dietary Guidelines or American Diabetic Association or whatever, which is not plant-based. And they don't have the support group set up. You go see a dietitian, you might counsel for an hour or two, and that's it, you're done with that. And now you're over and you're out on your own. Need that support. We really need that support. So we want to have the classes together, the support system set up, the mentorship program, and then infiltrate into the physician offices in order to really show them the evidence and tell them, listen, this is what the power of this could be, and this could really help your patients. And I'm hoping that they'll listen if we give them free food. And if a physician, say a cardiologist, says, hey, I'm willing to come in and talk with you during your lunch break about this, and we're not selling anything. So hopefully it'll be effective. But we're going to do other things. We're going to screen documentaries and get guest speakers. We're trying to develop a nutrition whole conference for the community, not for the healthcare world, but more for the community to get in and have a healthcare conference. We have a wonderful Veggie Fest in the Chicago area, which attracted something like 40-some thousand visitors. But you know what? The Veggie Fest, how much I love it, and I've gotten to know the organizers. It was not very healthy food. Oh man, it was a lot of processed food. It was a lot of oil, a lot of sugar, and very salty food. And I said, whoa, we really need our own little event like this, an annual event that is whole food plant-based and no added oil. We got to do this. And so we actually have one of our, we have a very strong board of directors already set up, and one of them worked for the National Restaurant Association organizing their conferences and stuff, and she is all in on the plant-based nutrition thing. I can help you organize this conference and this event. And so it's all very preliminary. It really is. But it's just amazing the support in the community that's come through with financial donations. Our website is cpbnm.org. It stands for Chicagoland Plant-Based Nutrition Movement.org, cpbnm.org. And it's just been amazing, the support. So we applied for a Plant Pure Nation Oasis Jumpstart. Hopefully, hoping we'll get approved. I spoke with them. It seems very positive. But we had a passionate plant-based nutritionist attend our first kickoff meeting for the organization. She said, hey, we can do this in our East Aurora High School, because high school students, you know, kids now there's a lot of overweight and obesity in kids. And why don't we go to this population that really needs help in nutrition and get the younger people involved. So we're hoping to do a Plant Pure Oasis Jumpstart within one of the high schools in the Aurora area, and in the Aurora area, and that would be phenomenal. So it's just starting out, but it's just been overwhelming how many people I've been in contact with who are in support, and they want to help out. And I've talked a lot to Paul Chaplin up in Detroit area, who has done somewhat of a similar model, and he's been so successful. He has a really great personal story himself, and I think he's up to, I think he told me 5,400 members.
Yeah, we're 5,000.
Yeah, and I think that their organization has been going on for about 5 years.
5 years. Yeah.
So, and he's been so successful. We're thinking, wow, Chicago is, I don't know exactly, double, triple the size of Detroit. We should hopefully be able to get 10, 15,000 members. We're really shooting for this, really going big. So.
That is fabulous. And I'd love to talk to you when we're done here about some ideas for you, because I've done a lot of different things and different aspects. I might be able to help a little bit. There is some great ideas that you have. When you talk about physicians, for example, so my daughter's a medical student and her fiance, and they're plant-based. So there's a culinary, I didn't have this as a medical student, but they have a culinary where they can, but it's like a culinary thing, but it's not everyone has to actually take it. It's something you can actually do on your own. It shows on their transcript, but it's not, it doesn't actually count towards graduation. But she's like, yeah, we volunteered to, we're going to show them that you can actually have yummy plant-based foods. I said, why don't you throw a little science in there too and say, hey, when you do this, is that, and, just some fun stuff to get them while you're young, right?
Yes,
to get these young minds. And you're exactly right. The how-to part, that is the key, right?
Yes.
In the community, because it got to the point that first year I was transitioning my practice. I was like, I kept getting the same questions. Well, beyond the protein problem question, which many RDs, by the way, they think when you go to a plant-based diet, they're like, well, you're going to be short on protein. I'm like, you're a registered dietitian. You should know.
Yeah, seriously.
Where does amino acids come from? Plants. So anyway, what happens is I built a 30-page handout that I used to give every single patient that I thought I would scan my daily 22 or 24 list of patients. I was like, yep, that one's coming in for UTI, but happens to have diabetes. This one has, and I would pull it out and hand it to them. I'm sure I killed some trees, and that was key. And then I went to Dr. Bernard's organization, and I got a Food for Life training. So I learned how to cook. We started a lifestyle medicine clinic, and I was cooking and doing this. And what's really interesting is people are really open to some physicians. And I think part of it, physicians think that patients aren't going to be interested. But you know what? That's not your place to make that decision.
Absolutely.
Right? And so that is the key there, was if you present it, they will come. They're, when we started the lifestyle medicine clinic, and I was in Western Colorado, it is like West Texas. Okay, there is ranches and meat and hunters, and I mean, I worked in a place called Rifle. That was the name, like Rifle, Colorado. And so when we did this, we just put out a little email it was a community health center, or a community hospital that had two of the largest employer groups in the city where I was I had switched over to Grand Junction, Colorado, still Western Colorado. And they had made some with the school district and the county saying, hey, we are offering this lifestyle medicine clinic to decrease your costs, because they were privately funded, insured groups. And so they were working with the local hospital, sort of like an APO, but not quite. And so what we did is we sent out a little email expecting maybe 30 people to show up as we introduced it. Had 106 people show up for the first meeting. I had to do it twice because there were so many people. And then we had to actually have them apply, because I only had space for 30 people. Wow. And we'd run these, would be about a 15-week program. We got the physical therapy department involved, and just some really cool stuff. We did our own study at the other hospital I was. It was really some really cool stuff, that people were getting better. And if I would have had the mindset, oh, nobody's interested, I'll just keep this to myself. Imagine all the people, and like you, now your community is going to change, right? You can change a whole city.
Yeah,
and so
I mean, we're certainly trying to, and it's our job as physicians to tell people what the data shows and what the best recommendation is. Not to tell them what they want to hear or what their culture told them to. You need to know what's right. And I sometimes preface it with, hey, nobody's perfect, really, but you got to know what's perfect, and you do your best, and I'm here to guide you to get to as close to a whole food plant-based diet as you possibly can. And even, the exercise component and all these other things, it's our job to tell people what's the right thing. And a lot of physicians just, they don't, because they don't think people are going to listen or do it. And it is true that we can talk people's ear off like crazy, and they might not make a single change, but we have to do it. We absolutely have to. It's our obligation as physicians to tell patients the right thing. And not that many patients might read the book that I give them, or watch the documentary, or read the 30-page handout or whatever that's given to them. But even if they're not interested in learning about the nutrition and reading about it, learning on their own, if you just say, hey, listen, all I want you to do, don't worry about reading things, just show up to this class, show up to this event, taste this food without them reading anything, reading any book or watching any documentary. They could show up and they could learn how great the food is, and you don't need to worry about it. Because honestly, some people just don't have that interest. They don't like reading books. Maybe they don't have Netflix to watch a lot of these documentaries, whatever it is. Just go and attend these events. And so we need to have that structure set up so that we can difficulty.
And then they know other people, right, in the community that are doing it as well. Yes. So when their families aren't on board at first, that's what happens. And when you cook for them, they're like, oh, that's really easy. Yeah. So I would cook for them. But you know what I did? I used the first part of Forks Over Knives. Darn Corey's a good friend of mine, the producer of Forks Over Knives. And there, that first running part, you know, that first introductory part.
Yes.
Right. That I show at, and that it's really powerful. And I remember seeing Richard Carmona, and he was saying how children, the next generation's children, are supposed to live 10 years less than their parents.
Yeah, and it's so true. I mean, you could just tell. It's sad, isn't it?
Oh my goodness.
And so, wow, the more I think about these things, the more it just really gets me being on the other side of it now. And that's one of the reasons why taking this approach with the Chicagoland plant-based nutrition movement, trying to change culture, give these resources, is we know that the change is not going to happen from the top down. They're not going to change a government policy. The food industry is not going to come out and make changes because, you know, it's a business. They want to make money. It's not their fault. It's not the food industry's fault. It's just the way the system is set up. So the only way to make the change is for the people to demand the change. And the only way that people will demand the change is if we could change the culture and make it easy for people. And that's what we have to do because, you know, not to get into all this other crazy paleo and keto and all this stuff, but our culture is more aligned with those dietary patterns because it's easy to go out and eat cheese and butter and all this stuff like that. Granted, obviously we know the data is not strong, and then there's a long-term benefit, and actually it's very harmful long-term to eat those dietary patterns. Whole food plant-based is clearly the way to go, but it's easier for people to eat those foods because that's what the culture has already told them to eat, and we've lost touch as a culture how to make good whole food plant-based meals taste great, satisfying, and we need to change that culture through the people first, and then you demand change by buying the healthy foods, and finally the food system will change, and hopefully these policies will change. It's a really, really daunting task to change culture. It's hard, but that is the way it's got to happen, and that's why, you know, Plant for Nation's got the whole great movement that they're trying to push forward together with the pods and trying to get everybody rallied and everybody together. We need to all get together as a community and put all of our efforts into this because that's the only way anything is ever going to change.
And that's one of the initiatives that we have at the Journal is we want to be the umbrella, right? We want to be the connector. And so what we also want to do is, outside of just having the Journal, but we want to translate that research into a disease reversal digest. Yes. And so we'll not only have the research presented there, but we're also going to have case studies and recipes and, you know, interviews with people like you and, you know, participants in places, and this is what's in your area. And we're going to make that so attractive, right? That, you know what, people are like, I don't have to be sick. It's kind of like, you know, there was, I'm big into mindset and reading about positive psychology because I think that's a very important part is the mental aspect of long-term habit change. And because I always am curious, well, why was one person able to make this and stick with it and someone wasn't, like quitting smoking? You know, it's, what is it that's that difference? And one thing that I've definitely found to be very, very effective with a patient is I create a vision of hope for them. Like they can't see a different future than the one they've been living. I was like, you know what? There is a different, and I'm going to paint it for you right now with these vibrant words that are make this color just so attractive that you won't want to walk away because you're like, it can be like that. Absolutely. But there was a Dr. Carol Dweck, and I can't remember if it was a YouTube video. I saw an interview because I'm just so fascinated by the whole, like if I can induce a growth mindset, you know, get someone out of this fixed mindset that this is the way it is, I can't learn anything different, it's just, you know, but move them into a growth mindset, there's change, I can listen, I can learn. That is key. Like how quickly can I do that? What words do I need to say? And she said that they were working with a bunch with kids, and she was working with kids that were in lower income or they were, you know, lower educational courses or classes because they were labeled challenged or special ed or whatever. And she was teaching them the growth mindset. And one of them started crying, and he goes, "You mean I don't have to be stupid?"
Huh.
And what was interesting was she took that, and this child just excelled. Like, he became one of the most vibrant students they had, and did amazing well. So that's how I see patient, right? So we've been giving them, they've been taught this fixed mindset, right, by medicine. Oh, you're sick, you have diabetes, you have to be on medications, you have to do this. But you know what? What's the flip side of this? Oh, no, you don't. Now, will you reverse your disease 100%? Maybe not. But you certainly can be in the most optimal health with a plant-based diet, and move us away from this. But 80% of it could probably be eliminated, or certainly decreased. And so you could feel better. You could, have more money, less medications. You don't have to go see a doctor. And that is so powerful for someone. It's that speaking. What words are we using as physicians, right? So I think that's the other key, is how do we speak to patients? It's not just spewing facts. It's we got to, let me tell you what I've done. I was like, because I get a lot of women that, I'm a family medicine doctor. Your wife's a female family medicine doctor. Most of her patients, if you're in a regular practice, are a lot of women. They're the women, they're cooking. Moms do a lot. And so when I can get a mom in there and they're worried about their kids, right? But my son doesn't want to eat his vegetables. I have to give him French fries. Like, first of all, you make that decision.
Yes. And
the second of all, I went into the research. I'm like, well, what are marketers doing? Because if you can market food to me that's going to kill me and I want to go eat it, it tastes, the fat and the salt, whatever. But there's got to be something we can use. And you go back and look at research where there are studies where people were trying to get kids to eat healthier. For example, in a school salad bar, they put up one little cartoon of like a cartoon character carrot, and it went up like, I don't know, like 50%, the peas or something. So I was like, So I created, exactly. So what I did is I went through all the research I could find, and all the blogs and all the mom blogs and everything I could find. I found 57 tips, and it's free on my website, of how to get your kids to eat more vegetables. And that stuff works. And, I always remind them, it's like, you have to be persistent. It's 15 times to the palate, and then it will be incorporated. That is how you do that. But you have to get away from this other stuff so they'll eat. But you're exactly right. We have to present this material and give them hope, and give them a community and a structure and a network.
It definitely has to be put in a positive mindset. You focus on the positives. If you focus on the negatives, people get all down on themselves, and it doesn't work. I knew one cardiologist that would walk into the room and say, "You have hypertension, diabetes, you're obese, of course you're having chest pain." And I'm like, how effective is that? That's not really the way you should be. And so you really, there's a whole course that people can take actually on motivational interviewing. And I really want to do that these days to hone my skills in it, because every patient is different as to what their triggers are for their food addictions or their stress in their life or their culture. You really got to individualize it from person to person. But no matter where that person comes from, you definitely have to focus on the positives. I completely agree there. But tell them, listen, you have the most control over your health. It's not just it's not fate. It's not up to your doctor to give you the right medicines. It's within your own control, and this is the positive future that you can have. I completely agree with you.
Yeah, when you're talking about for those who don't know, motivational interviewing, you're just basically finding where the patient is ready in this graduated level of readiness for change, basically, and your certain things that you do. But for me, the problem with motivational interviewing, and you learn a lot from it, because you learn a lot about mindset and where people are. It's hard to remember. It's like, okay, if I ask this question, that means they're here, and then I say this. There's one thing in human nature that is common. They want hope, and they want to thrive. Okay. If you can find the one thing, then there's a few questions you can ask. What is it that, if you had a future that was not inhibited by chronic disease or your back pain or your diabetes or your 300 pounds, what is it? Okay, let's see if we can get there. And then that is the key, right? Because now we've moved them from this mind of, you're opening up their blinders, right? You're taking it away. It's like, you're literally the mud's falling off. It's, almost biblical in a sense. Like, it's just like, whew, the scales fall off. And it's just like, this is your future. This is a choice. It's a small arc degree, and off you go. And that is, if we can get the physicians just enthused about getting people excited.
It needs to be. I mean, those types of things need to be a lot more stressed in their curriculum. Medical training.
Right.
It really needs to be not just the whole nutrition component of it, and the whole lifestyle medicine component of it, but how to really affect positive lifestyle change. It really has. I know it's hard because a physician only has 15 minutes with their patient frequently. That's all you have.
Right.
And so you start asking about diet and lifestyle, it opens up this huge conversation. And the way our model is set up is doctors really don't get paid for this. They see fewer patients if they talk to their patients about diet and lifestyle. And if they get their patients to be so darn healthy and averse to their diseases, they don't need their physician any longer. And so it's just really sad that the system is not set up that way. And that definitely needs to change. But yeah, I really wish I was trained more in how to affect a person's ability to make the right choices and take those blinders off and really see the positives and see the hope that they have.
You should read Mindset by Carol Dweck. And there's a really
heard of that, yes.
Yes, and then there's Flourish by Dr. Marty Seligman. Yeah. And I'll tell you what, the positive psychology, what really got me, because I was in active duty Air Force, and so was my husband. So when I would get patients coming back and I was deployed over to the Middle East, I wasn't in the crux of, the fighting and stuff, but I certainly saw the aftermath of patients, and you're sitting here and their PTSD, and it's just the lives falling apart and all these depression and the high suicide rate. And what was interesting was with Marty Seligman, and the positive psychology, kind of the father of positive psychology, and working with the U.S. Army. And what they found is if they would teach people basically a resiliency, or teach them, it's like a growth mindset. It's a change. It's a change. It's, it's the same thing, I think, but just different terminology from the studying that I'm doing. What you find is that they had 50% less PTSD coming back.
Wow.
And I'm like, well, what if I could teach my doctors that, right? If I can go in and I can teach a medical student, this is what resiliency is. This is a growth mindset. And move them to a growth mindset. We all have the balance, right? We have fixed mindsets about certain things or growth, but we should be able to hear that that's an audible voice that we can turn. We can change, turn down, and listen to, turn it up, dial something else up. If I could teach these young students in not some complicated structure, this is how you do this, and but just the wording, and get them to understand intuitively how their own thinking. Then what's going to happen? That'll be a natural interview process. If I can work with patients, young people, how your doctors, this is how you talk to a patient. This is going to get them to change their mindset. So what are they going to do for their own health? If you teach these young ones how to speak to themselves this way, take care of themselves as physicians, we have the highest suicide rate of any profession, right? Yeah. We have, and that's a whole nother level of craziness.
That's a whole different conversation. It's crazy.
Lord help.
But along those same lines, it's so important that physicians need to take care of their own health and follow a healthy dietary pattern themselves, because if they don't do it, how can they be example for their patients? So, I kind of think back man, when I had a patient that was seeing me at 265 pounds, thinking, this guy is telling me to eat healthy. Come on,
Right.
You need to, if physicians don't practice a healthy lifestyle themselves, then they almost have no right to really discuss it as much with their patients. You need to take care of yourself first.
Right.
Take care of yourself first. Show people how you could thrive on it, how great it is, and then the patients will see how powerful it is and listen to you. And so
right.
It's super important.
There is actually studies showing that patients whose physicians, I think they put like a bike helmet or something, and there was some type of indicator that their physician was physically active and eating healthy, that they actually were more likely, one, the physician was more likely to speak about it, but two, that you're building credibility because you walk the talk, right? So then their patients are more likely to follow their advice. Yeah. And so you're exactly right. That's one of the reasons I'm making it so public, my training to go climb Mount Rainier next year. Because I'm like, this is what you can do, people. So that is what we have to do. We have to be leaders in our community, because that's what we're all about.
And I love it how it's compared to the whole tobacco debacle in the 1960s. It's just such a perfect analogy that there were all this research that actually showed that tobacco wasn't all that harmful initially. A lot of that's funded by tobacco, of course, and it was very confusing because all that data wasn't as available back then, because now we got the internet, PubMed, and all these different things. But most physicians themselves smoked cigarettes in the early 1960s, right? They didn't read the research. They just think, hey, I'm doing medications and surgeries and all these stuff. Smoking, that's not really my job. Just like now, a lot of doctors don't really take nutrition seriously, and they don't themselves follow a healthy diet. But it totally makes sense that when, the equivalent now of what it used to be in the 1960s to stop smoking, now the current day equivalent is going on a whole food plant-based diet. Because the data is there, but our culture is against it, and doctors don't really take it seriously. So back in the early 1960s, it's exactly the same. And you hear so many crazy stories of doctors smoking cigarettes during conferences. And I have this one crazy story of a patient who had a couple bypasses at Cleveland Clinic, and he showed me the scar. It was Dr. Sohn's patient, if you know who he was. He was a very famous cardiologist. He developed a Sohn's technique in his arm, to cut down the arm to go in and do an angiogram of the coronary arteries. They say, hey, look, this is where Dr. Sohn's cut me. And I'm looking at it going, wow, it's a Dr. Sohn's scar. This is like legendary. This is great. And he says, yeah. And 2 inches past that is where Dr. Sohn's dropped his cigarette on me during the procedure and burned me. And granted, it's just a patient's story, and I don't just not valid, and not, I don't know if it's true or not, but that's what the patient told me, and he shows me that scar. It's crazy thinking that physicians were smoking during procedures. And I mean, nowadays you don't see physicians eating burgers or something like that during procedures, but it's kind of very similar that physicians themselves don't follow the healthy diet and lifestyle, and it needs to change. And that's part of the culture shift that we really need to have, and hopefully, at least in the Chicago area, we're going to be able to make a difference with our organization. But that mindset must shift, and it's just exactly the same as tobacco, because now we got the food industry funding research confusing the public just left and right. It is so challenging for people to know what is the right evidence-based way to eat. And so when they don't know what's right and what's wrong, they just follow what their culture tells them to eat and what tastes good to them, and that's not usually going to be the right thing in general. And so there's so many different barriers that we need to overcome. But again, with the enthusiasm of all these wonderful people that I've met and connected with the last year or so, I'm pretty confident that we're going to make a big difference and get this.
We're hitting a critical mass, I think. I interviewed Dr. McDougall.
Heard that one, yeah.
He's a salty character, that one, and I love him to death, because his website honestly was one of the one website I could find actually like, doctor, do this, and I'm like, yes, thank you. A little bit of some type of template for me to kind of balance and grow my practice on, and I was really like, Dr. McDougall, this is great. The Plant Nutrition Project, they're expecting 1,200 this coming year, and this and that, and more doctors are calling me on a regular basis, and blah, blah, blah. He's like, nope, doesn't matter, not going to change. And I'm like, but it will change.
It's crazy, because when I first learned about whole food plant-based diet, watch Focus Over Knives, I'm thinking, oh my gosh, this is huge. I need to tell everybody about it. Nobody knows about this stuff. And then I go back and I look and I'm like, well, wait a second. There were actually similar documentaries 10, 15, 20 years ago that were talking about this. I was like, oh, so this has been out for a long time. Why hasn't more change happened yet? Why hasn't it? And so I kind of was shocked by that. And I think that there's more and more knowledge being spread. The younger generation really understands this, because we are reaching a crisis point with the rates of chronic diseases, with the cost of healthcare, not to mention the environmental aspects, all these different things. It's a crisis at this point in time. And so people now are really, really seeing that the change must happen. And there's really no other way around it. There's no pill that's going to cure heart disease or hypertension or diabetes. It's not going to happen with some kind of crazy laser gadget or surgical procedure. It's the food. It's got to be the food, and we have to make the change. Everybody's realizing it, and a lot of it is these documentaries and social media is really becoming more powerful, and people are getting more savvy and spreading things out a lot more effectively nowadays. With What the Health had a major impact, and
it did.
At least a couple times a week, I get people saying, "Oh, you're only plant-based because of What the Health." No, randomly in the store, hear people talking about it. It's great, and the Game Changers, the upcoming one, is gonna.
That's a fantastic one. I watched it in Boulder and at the film festival. It's amazing.
I hear it's better than, it's not, I wouldn't say better than What the Health. It's different than What the Health. It's going to have as much of an impact as What the Health does, if not a greater impact.
It goes to the heart of men.
Yes.
And so it's going to go to the macho, the ego of men and meat. And, certainly there's women athletes there, but it goes to the heart of that. So I took my youngest son, he's pure plant-based. That kid is on. but it was really cool. He goes, yeah, well, that was good. That was really good. Then there's one on the testosterone and the NFL players. Oh, it's good. That is actually really good. Yeah. So just an incredible thing to see all of these things happening, right? But we need that coalesce, like exactly. We need to come together and really work. Yes. And that's one of the things at first the podcast was just to share stories, but now it's become, I want to be part of that, pulling everyone together and saying, someone in now Chicago is going to know, hey, this is available. Hey, this is a story of someone who, reversed, put their Crohn's into remission. Hey, here is 5 stories of diabetics who are no longer on insulin and reversed it, and their family's dying around them, but they don't have to. So that is great.
And the stories are powerful, but what's also growing, which is great, is not just the anecdotal stories, it's the actual evidence, the peer-reviewed publications, which is part of what your journal is going to be doing. And as that grows, that's when you're going to convince more of the healthcare industry, physicians and stuff, as more and more evidence comes out. And again, for heart disease, there's definitely enough evidence right now. Some of the other diseases, some of the autoimmune diseases, I wish there was more randomized type, clinical trials and such. And certainly for many of the cancers, I just don't understand why there hasn't been more cancer-related whole food plant-based. At least have an arm where it doesn't. You don't have to not give them the chemotherapy. Right.
But if they have a different outcome, right? Do they have less chemo side effects? Do they have a longer survival rate? Do they have a less, remission rate? Exactly. No one's saying withhold your traditional medicine. It's just, well, let's augment, shall we?
Yes, and I bet you if they did that with the breast cancer study or colon cancer study,
prostate,
they would see dramatic benefits in the patients who received their standard chemotherapy, but this arm got whole food plant-based, and this arm, there was really no dietary advice given besides the standard stuff. I think it would be a dramatic benefit, but we need that to be done, and we need that to be published, and then finally people will say it. And then you'll have the arm of the people who refuse the chemotherapy, but then you randomize them to the whole food plant-based versus standard. And then if they refuse the chemo, then you can see the effect that the dietary factors truly has on cancer progression. I really wish we could see that data. That would be great.
That is the journal, what we really want. We want to bring this to the front of researchers, right? Like we want to say, hey, this is where you guys need to focus because this is where you're going to be a change. So part of the journal, what we're going to have done is actually patient stories, but then we're going to, if we can, we'd like to get their physician or a science, a science writer to look at their actual lab results, their story, and dissect it and go backwards, right? So here's their story, and now here's the studies and the evidence to prove and say these aren't just anecdotal stories. So it's kind of a case report and backwards. So you have the patient telling it, but their story, but I'm also going to be interviewing them. So we're going to have a podcast for the journal, and we're going to have video abstracts, and we're going to be interviewing these individuals. And so I can use my enjoyment of just talking to people. How often is that I get to talk to people and spread this message? That is really so exciting, right? So we can really just move forward, and so it's fantastic. What's funny is this is a funny when you mentioned the drug reps. So I worked, they come family practice because you see especially in Western Colorado, it's a small rural area. We have lots of different, we had no ICUs, pediatric ICUs in the entire western side of the state. Wow. Okay. So, I did hospital care. I did, nursing home. I was director of the hospice program. You do your regular clinic. The only thing I wasn't doing was delivering babies, which I didn't want. I've done 40 and I'm good. But what was interesting was the drug reps would come in, because this is you do everything. They do all sorts of drugs. And I was like, I actually got 2 drug reps to go plant-based. And what was interesting, I said, do not bring us food that's not healthy, because I won't come and I won't listen and I won't eat it. And I won't don't talk I'm willing to listen to you about your drug, but if you have to feed us well. So then they would bring salads and they bring all these plant-based stuff. It's so funny. But then they would get a new drug rep and they bring pizza and they go, oh, Dr. Marvis hasn't talked to that one yet. Let's go see what. So, it was really funny because I would take over their drug conversations. Like, let's talk about plants. And why you're not bringing pizza anymore? Because I don't want you to make my people sick here.
Absolutely. Yeah, that makes a lot of sense.
Yeah, it was fun.
it's really those drug reps too. They're effective. I mean, they really, when they get at them, we're talking about us getting at the medical students in order to try to get them the whole plant-based mindset and all that stuff. Well, they're going at it too. They're trying, and I fell victim to that when I was a medical student. Once a month or so, at least, we were taken out to a nice steak dinner, and it was a good time with your buddies, and you got to go out and have this expensive dinner because medical students have no money. But it was always, hey, the only solution to hypertension is this medication, and it really completely removed the medical student from the mindset of the power of nutrition and lifestyle change to treat the hypertension or the diabetes or whatever it was. It really removed that whole factor. And so it's just, wow. I don't know if that still takes place, but I'm assuming those things still take place. It was only 15 years ago for me. So
yeah, I would think so. But the other thing is though too, but look at, even when these medical students are little kids, what are they watching on television?
Right.
They're watching commercials of people who are helping, they're walking and they're taking this drug for their diabetes, and talk to your doctor about this. Or
there's a commercial for pizza or soda pop, right?
Right, exactly.
Diseases that they need to sell the drugs for. It's like as a culture we've been duped. It's eat these unhealthy foods because your culture tells us to. That's what the food industry says. And hey, now because of these unhealthy foods, you need to take all these drugs, and it's just one commercial after the other. Take this drug, eat this food. Take this drug, eat this food. It's like, no, I almost don't want my kids to watch TV anymore. My son's into baseball, and he wants to watch a baseball game, and all it is these commercials for these unhealthy foods. I'm like, no, I'm pausing it and fast forwarding through commercials because I don't want you to see this stuff. I don't want you to get brainwashed the way I was brainwashed.
Yeah, we haven't had a television in 18 months. I love it.
That's great. Yeah, we don't do television during the week. They get a teeny bit during the weekends, and it's very controlled usually, very minimal screen time. But man, I tell you, I wish the broccoli industry had enough money to advertise during the Super Bowl. Wouldn't that be great? Broccoli dancing around in a Super Bowl commercial.
You seen, there was a SNL, the Saturday Night Live with, what's his name? Yes, the tofu guy. Oh, I should put a link to that. That is so funny. Like something like that. Yeah. Oh my gosh, that would be fab. Or barbecue jackfruit.
Yeah, why not?
Why not? And you see someone chowing down on this really yummy barbecue jackfruit sandwich, and their barbecued, cauliflower, and they're like slim and trim, and then you like explain what it is. I mean, that would be like, people go like, huh?
Yeah.
What's going on here? A little kombucha on the side. You're good. Oh my goodness. Well, you have got so much going on. It's so exciting. I can't wait to see whatever is going. And I love Chicago. It's one of my favorite cities. It is a cool place.
It's a great city, but it has a history of, very unhealthy diet, like most places do. And so it's a big task, but we got to change it.
Absolutely. Absolutely. I love that architecture ride and through the boat.
Yes.
That is really cool. So if you guys ever go, besides checking out your stuff, they got to check out the boat ride and learn the architecture of Chicago and the history. It's pretty cool. Wow. Well, sir, I will put all your links and your amazing information. And we have talked your ear. Bless your heart.
No, I've enjoyed it. This has been a great conversation.
It is a lot of fun. And it's so fun to be around, the same-minded individuals, and you're taking it a whole approach the way you should. Oh, I should introduce you to Arjan and Shobha Rayapudi. I introduced them. They're in Canada, in Newfoundland, and they're taking this community approach well and have really good success.
Oh, that's great. I love it.
Yeah, I'll connect you via email, and that's amazing. Yeah, they're amazing too, and so that is. They're amazing people too. There's just so many cool people.
Yeah, there is a lot, and it's great to meet everybody and see with all this enthusiasm and knowledge and passion. Really, I think that's the big key that's moving all this forward, and it's happening. It's great.
Yeah, it is. You are exactly right, and we'll get it done. We will get it done. To my dying breath, we will get it done.
I'm a little more positive than Dr. McDougall, I guess, on the whole.
Sorry, thank you. But to Dr. McDougall's credit, he was there when nobody was listening.
Absolutely.
And his hashtag, it's the food.
Yep.
It's the food.
That's right. Yep.
It's the food. You're exactly right. Well, thank you again. And everyone, please watch below. I'll list everything and to the links and how to get hold of the wonderful Dr. Lome. Thank you again so much.
Thank you very much. It's been a pleasure.